In this video, we're going to discuss the flow of funds when a professional medical corporation operates a medical spa, specifically in the context of an MSO-PC model of healthcare business. PC stands for Professional Corporation. In our context, it means a practice of medicine that consists of licensed physicians in the state where the med spa and/or wellness practice is operating. The term MSO stands for Management Services Organization. When a medical practice wants to focus solely on the practice of medicine and patient care, it will often work with an MSO to provide specific management services, which help the business run more effectively. These services range from facilities management to sales and marketing. They can include human resources, payroll, bookkeeping, and accounting, just to name a few. Now let's get to the flow of funds for a med spa. It begins with patients paying for services like laser treatments, intravenous nutrients, compounded medications, or other injectables. These types of services are medically supervised and thus should flow first through a bank account, which is operated in the name of the practice. This bank account is referred to as the revenue account. This allows an important distinction to be made between revenue generated as a result of the practice of medicine and all other types of revenue generated by the med spa, such as skincare, facials, massages, supplements, and things like tangible goods. Those types of revenue could go into a separate bank account, often in the name of the MSO, as they are not medically supervised. The MSO will then use the PC revenue account to pay for various qualified expenses on behalf of the practice, according to the management services agreement between the two parties. Qualified expenses often include medical supplies such as syringes, needles, etc., insurance such as medical liability and property insurance for the med spa, medical director supervision fees, any on-site medications that are used to see patients, payroll for licensed workers such as nurse injectors, and accounting and bookkeeping costs. Additionally, the PC's revenue account is used to pay the MSO's management and licensing fees each month. Now let's move our focus onto the MSO. The MSO uses the management fees paid to it by the PC to cover administrative, management, and licensing costs. Such costs include property lease, equipment, marketing, website, customer journey services such as feedback surveys, and other costs. The remaining revenue is used to pay the salary of the MSO's operators on a W-2 classification. Any remaining funds are then paid out in shareholder distributions to owners and shareholders. As you can see, patient fees flow into the revenue account first. The med spa then uses those fees to pay for eligible expenses. It also pays the MSO for management and licensing services. The MSO uses those fees to pay for the cost of those services. It then pays its owners and shareholders. This is the basic flow of funds of a med spa practice in the context of the MSO-PC model of healthcare business operations.